Hello, my name is ALFRED CERA with the student ID N41382614. Module aim is continuous professional development. Understanding sector needs. By following the market trends like technological improvements, societal transformation, and policy changes are important to change an organization. For instance, with the increasing nature of digital learning platforms, nurses must adopt online pedagogy and instruction design. In healthcare, the focus on mental health training for nurses is important. Stakeholder expectation and identifying changing demand of customer employers. Like customers demand on sustainability, organization focus on construction and design to embrace environmentally friendly techniques. Identifying changes in personal practice. By developing new skills to remain competitive or satisfy emerging sector demands. Gaining certification in digital tools such as data analytics software, project management system may improve one's skills. By observing changing in the health sector and taking note of how work processes such as organization move from traditional to agile project management from work can improve efficiency and responsiveness. Adopting innovation which leads to knowing how technologies and techniques can be integrated to develop health facilities. Entertaining all tools can be included into creative work and easy service delivery operation. Addressing key drivers of change. Like other industries, the health sector also has become more tech-driven. Personal development includes digital literacy, and adopting automation can be a better solution for a nurse. Conforming to new rules and norms regarding data management and environmental requirements in the health sector must be observed due to its changing nature. On the other hand, increasing cultural competence or implementing inclusive practice to remain competitive with the global and societal standards can be a positive outcome for further development. Demonstrate analytical, reflective, and reflective practitioner skills. To provide high standards in the health sector, nurses must have analytical and practitioner skills. These abilities consist of evaluating situations, recognizing bigger consequences, and allows learning from experience to develop the performance of nurses. Analytical reflective skill. Nurses employ their analytical skills to evaluate clinical circumstances and make evidence-based judgments. For example, when a patient exhibits unusual symptoms, a nurse collects and analyzes data like vital signs, medical history, and lab findings to determine possible causes. Critical thinking ensures the interventions are timely and accurate. Furthermore, evaluating feedback for patient outcomes or team discussion and identifying patterns, such as frequent medication errors, which prompts process modification to improve patient safety. Recommended by Mohamed Shambo, effective decision making and critical reflection in service can lead to meaningful learning for nurses. On-the-job learning can last a lifetime. According to the Nation of Knowledge, meaningful learning requires a combination of prior knowledges. As repetition does not consider past experience of current context. Nurses cannot drive change and progress in their work are without considering the social cultural environment, personal motivation, and the understanding of social control and health management systems. Poor management abilities can impair public health and have legal consequences for managers and the healthcare professionals. Reflective practitioner skill. Reflection allows nurses to evaluate their own action and experience in order to learn and improve professionally, suggested by Fontaine that nurses who follow routines or habits may function at a lower level of effectiveness than those who adhere to best practice beliefs. Repetitive and routine practice can lead to missed opportunities for reflection, the mistake patterns that can be challenging to overcome. Reflective practitioners can help nurses to discover workplace patterns, improve care quality, and foster personal and professional growth. Identified key underlying abilities that must be cultivated in order to successfully engage in reflection and action. All these competencies include self-awareness, description, critical analysis, synthesis, and evaluation. Self-awareness is an essential skill for a reflective practitioner. Self-awareness allows one to evaluate behavior, influence, and impact on a situation. Description involves recalling key aspect of event to provide a full narrative. When writing a description, keep it concise and construct the event from one's point of view. Critical analysis is essential for good role playing. It involves breaking down an event into its basic elements and examining each component in detail to see how they interact and influence one another. Critical analysis involves identifying important knowledge, challenging assumptions, and considering alternative on action. Critique is good on the constructive process that can discover areas for growth in practice. Synthesis integrate new knowledge, sentiments and attitudes to achieve undesirable solution through reflection, to effect change and establish new perspectives or insights. Individuals must engage in original thinking. Mentioned by NG at L evaluation is the ability to reflect on the past in order to determine the value of something. Evaluation can be done externally using predetermined criteria of standards or internally or personal self-assessment procedure. Evaluation identifies gaps and informs future action plans or improvements. Critical analysis progress in developing a range of core employability skills reflecting compassion, values, and behaviors. Employability skills in nursing, particularly those expressing compassion, beliefs, and behaviors, have made great development, but there are still issues ahead. Compassion, a key component of nursing practice, has been emphasized through improved training programs and reflection techniques aimed at building empathy and patient-centered care. Efforts like compassion-focused care models and simulation-based learning have aided nurses in better understanding and responding to patient needs. Nurses and students should have the courage to embody their inner caring ideals, and become the person that nurses they want to be. Reflection empowers nursing students to define their moral ideas when confronted with ethical challenges. Observing the suffering of patients requires bravery and enables nurses to deliver ethical care. A strong desire and courage to provide care are essential for nurses' professional development. Furthermore, knowledge builds confidence and encourages them to trust themselves. These nurses believe that personal growth emerges from their confidence and understanding. The incorporation of values like respect, trust, honesty, and accountability in the everyday practice is unequal. While many healthcare organizations have used frameworks like the NIH's consideration to instill these ideals, systemic concerns such as insufficient staffing and high workloads could hinder the continuous implementation. Nurses may struggle to maintain compassionate care under time limits, workloads, perhaps compromising patients' satisfaction and the results. Collaboration between professions and the collaborative practice models have been beneficial to behavioral development, especially in terms of communication and collaboration. However, cultural and organization and our cultural and organizational challenges might prevent healthcare teams from communicating openly and respectfully. Self-awareness and cooperation and one's responsibilities are crucial for nursing students to become responsible nurses. Reflection and evaluation are used to better one action and being. This idea motivates nurses to be responsible and compassionate individuals. Continuous professional development and programs for mentoring are critical for closing this gap. While progress has been made, long-term investment in a resource support system and reflective opportunities is required to ensure that compassion, values, and professional behaviors are profoundly established through nursing practice. Nursing practice developing the compassionate nurses by integrating their knowledge, skills, beliefs, and attitudes that promote patient well-being and healing. This reference and thank you.